years ago.
She's been practicing medicine for 30 plus years in the state of Michigan, I believe.
Yes.
She's also a national speaker in the field of nutrition and chronic disease. She's a member of the Nutritional Advisory Board for the Cancer Treatment Centers of America, and her approach to patient care is holistic and centers on mind, body, and spirit connection. She brings a special focus of lifestyle and dietary changes to her medical practice, and we've had the absolute, I would say, joy, honestly, and privilege to have Dr. Browne associated with Bodywise International for quite a few years. I think probably over 25. I know him
Since 96. 96. Yep.
96. There you go.
Mhm.
So, Dr. Browne, welcome to the call. Really appreciate you taking the time. I hope your mom's doing okay in Minnesota besides freezing.
She is.
We're going to be talking this evening about supporting our immune system. Really, the important parts, obviously all of the parts when it comes to immune health. But you have a program or a project that you've been working on. I know is near and dear to your heart. Over in Uganda, I know you guys are in the middle of building a hospital for folks. I'm not sure what the name of it is. I know what it used to be, but I think they've renamed it. So why don't you share?
It used to be the Zion Family Health Clinic because it was
Right.
going to be a one-story medical dental clinic. And we said, we can do that. Tell us what you want. We'll try to raise the money. And they kept asking for more and more and more. And now, in case they think we have endless money. And now it's a 5-story hospital. And so it's been renamed to Soyan, which is Zion in Hebrew, Family Hospital. And it is beautiful. The structure is almost complete. It's complete from the outside. We do not have the money to put in the carriage for the elevator yet. We need $33,000 for that. The elevator shaft is in. And we need to do landscaping because they get rainy season, which is happening, and everything's turning to mud. So we're trying to get sidewalks in, and we have to equip it, and we have to furnish it, and we're working a lot with World Medical Relief, and they are donating equipment, and plus we are scrounging equipment from hospitals. What are you needing to get rid of? And it doesn't have to be fancy to go to Uganda. It just has to work. But it costs $33,000 to send a shipping container. It has to be shipped from the US. Really, goes through the Great Lakes, goes over to Kenya, then it's trucked to Kampala, the capital of Uganda. And then we have to go through all these inspections and bribes and things you have to pay so that they'll let you then bring it to the hospital and actually unload it. And so we have one container there now, and we'll probably need to send 2 or 3 more to actually furnish the hospital. And then we have to pay salaries. And they're nothing like salaries in this country. So for example, a doctor there, when we first started this, a good salary was going to be $10,000 a year. And we thought we could entice people to come out to the bush because this is not any city. This is nothing there. Just a little village, basically, by paying that exorbitant amount. Well, prices have now gone up. So we thought we could keep the whole hospital running for $250,000 a year. And we think now it's going to cost at least $300,000. And we are out of money. We have raised over $600,000 during the pandemic to get this far, and we were stunned. I mean, people have been great, but these people have nothing. We take healthcare so much for granted in this country that we have enough to eat. We can feed our children. They can't feed their children. Their children die. They have babies after babies, and they die because they can't feed them. They don't have vaccines. They don't have healthcare. And I think we have so much, we just have to give back. I think it's an important thing to do to help balance the universe.
Well, I know that we sent an email out talking about contact information if people wanted to participate and support this cause. Has that changed because the name of the hospital's changed, or can people donate through the links that was on in that email?
Yes, and there was a the symbol they could do, that one works. Amazon Smile is another good way to donate. And Amazon Smile is a wonderful philanthropic part of Amazon. And if you sign up, smile.amazon, and you have to pick a charity. So building up, partnering in health and wholeness is our whole name, no punctuation. And you put that name in, they find it, you click on it, and then 0.5% of what you have spent is going to go to us. And anytime you buy anything from Amazon.
Oh,
and
okay.
So, yeah, so it's not very much. And each, I mean, it's 0.5%, but you get enough people doing that, it can add up to money, and it does not come out of your own pocket. It comes out of Amazon's profits.
Well, that's something I think that John Paul probably could send out a link or could send out an email with the different mechanisms available so that we can help support that for those of us.
It takes 2 minutes to sign up. We will take donations of any amount. My favorite donation came from a 12-year-old girl who gave me $10. It was her allowance. And because she was so impressed that these kids had nothing, and she knew she had a lot. And, do I like the people who give me $5,000? Yes. But, that one came from the heart. So, I really remember that one a lot.
Excellent. Well, I'm sure we'll continue to communicate with the people at BodyWise, and I'm sure you'll get some support from those of us that have it. So
the BodyWise family is a generous family. So let me see it.
Sounds good to me. I think that's a good request, and one that should be able to be handled pretty well. What I'd like to do now is talk a little bit about immunity. I've got a few questions I'd like to ask you, but do you have anything just in general you'd like to start the call off with from your perspective, or you want me to just ask you some questions?
Well, I will say that the immune system is the foundation of your whole body. It runs every part of your body. You don't think about that. You think, oh, it just helps you fight off infection and things. It's important in every single system of the body. And the thing about the immune system is, as long as it's working, you don't really know anything about it. You don't think about it. But because you don't see it, you don't feel it. It's not like your heart beating or breathing or something like that, your muscles moving. But when it goes awry, and there are many reasons that happens, then, all hell can break loose. And people I see, I'm an oncologist. So people come to me all the time and say, but I've always been so healthy. How did I suddenly get this cancer? Well, I said, well, you didn't just suddenly get it. This has been brewing for a long time because you haven't been taking care of yourself, and your immune system was not able to counteract that. So there's lots of things you can, try to do, but it's very hard to change our lifestyle. Most cancers are lifestyle induced. Very few cancers are actually genetic. And we don't like to change our lifestyle unless we're really hit over the head with something important that says, now you've got to do it. And you just look at, we're a nation of obese people, and, we don't exercise. We know we shouldn't be doing these things, but we still do it because we think, oh, well, I still feel okay. I've gotten away with this. And then boom, all of a sudden something catastrophic happens and you realize, oh, now it doesn't work.
Well, let me ask you something. And I think I know the answer, but I always like to get healthcare professionals' perspective on this. And question, kind of a two-part, are we post-COVID, post-variant, or is it never going to be in our rearview mirror, or is it always going to be around, kind of like the flu?
I think it's always going to be around like the flu. And I think it's just been too widespread, too long acting. I mean, the fact that we don't even know really when it started in China because they weren't really letting on. We know, okay, it was December of 19 when they let the cat out of the bag. But I think that was only because they couldn't hold it back anymore because it was because it was becoming so widespread. So had it been there already a year, 6 months, don't know. But, I don't think it's ever going away. And I think I've had it twice. I've been vaccinated. Well, the first time we didn't have vaccines yet, but, and I think it's going to continue to be there, because it's in the whole world. And I think there's no part of the world that has escaped. And so when you have something of that magnitude, it's very hard to make it completely dormant unless you have really, really good vaccines, like what we did with polio. Well, now polio is on its way back. People are getting polio again because people didn't get vaccinated. And so we're starting to see polio again. And polio kind of lives in the dirt, the virus, but people weren't getting it anymore. But now it's back. So the vaccines for COVID are not as good. It's not like polio, where you get, so it's like a flu vaccine. They have to look at what are the variants of that year and try to put it together, but they mutate so fast. And polio wasn't doing that. So we were at smallpox, we were able to kind of put those mostly in our rearview mirror. But I do put on an appeal for people. Polio is a devastating thing. And it's not a live virus. So get your kids vaccinated for polio. And the other one is HPV. And when my oldest kids were teenagers, the vaccine had just come out. And I said, ooh, I think I'm going to wait a little bit and kind of see how it goes. Well, of course, now HPV is ubiquitous. Everybody's got HPV. And I'm dealing with those cancers. And it's 50% of all the head and neck cancers are driven by HPV. And people don't think about that. And these head and neck cancers are devastating. We cure an awful lot of them, but people end up disfigured. They have long-term complications that really affect their quality of life. And so it's not just it's not just cervical cancer and anal cancer. It's all these head and neck cancers. And so my second set of kids, yes, I got them vaccinated, and I'm hoping that will protect them. We think that was a pretty good vaccine. I don't think the COVID vaccine has been that great a vaccine, but we've learned more, and people who are vaccinated are not dying as much as people who aren't vaccinated. So by and large, you may still get it, but maybe not to the same severity.
I see. Well, I hate even the general public, for the most part, always looks at flu and cold season because that's been the mantra since I can remember, and I go back a long ways. So, but from, and our supplements backwards and forwards. So as we go into the cold and flu season or whatever during the winter time, I think people should look at this 24/7, 365 myself. But as you look over our supplements, what do you recommend from a immune support insurance policy, if you would, to try and give your body the best chance for optimal health, especially when it comes to immunity?
First of all, I tell my patients too, I recommend a high quality multivitamin. I send them to AM and PMs usually because I think they're excellent. They're not that expensive compared to some of the other ones. I've been perfectly frank. My husband takes one that's $150 a month, but most people can't do that, and it's an awfully fine vitamin. But is it that much better than AM and PMs? I'm not so sure it is. And so that's what I put my patients on. My kids are on it, and that's for basic health. That helps your cells run better. And I tell people, if you don't give your cells what they need to make repairs, you'll end up eventually being sick. If your cells can repair, you'll stay healthier. I tell people, I make patients all the time, if you don't repair your car or you don't repair your house, eventually you're going to have real problems. They go, oh, yeah. And I say, if you want to take the real inexpensive vitamins, they use the forms that don't work. That's why they're cheap. And so that doesn't help you. So you have to use one that uses forms that actually your cell is going to use to make repairs, that will get into the cell and use to make repairs. So that's usually my foundation. And then I'm saying, you know, AG Immune or AIE10 is a brilliant product because it resends the chemical signals that tells the cell, the immune system, what to do. The whole body is run off of chemical signals. That's inside the body. That's all the information is going back and forth with chemical signals. Even your thoughts are translated into chemical signals called neuropeptides. So all the cells of your body know what you were thinking. That's how mind-body medicine works. That's only been discovered in my lifetime as a physician. So the whole field of mind-body medicine is just now exploding. But all the communication in the body is sent by these chemical signals called cytokines. And AIE10 is a cytokine product. It's resending the chemical signals that tell the immune system what to do. And if it already knows what to do, it says, I already know that. And so it kind of ignores that. But if it doesn't know it, if it's going, you know, not working properly, it goes, oh, okay, that's what I'm supposed to do. And so with proper lifestyle, it can actually help repair the immune system. And I tell people, if you live on Big Macs and donuts, it's not gonna do the trick. But if you're trying to do clean living and have good nutrition and do other things like get enough sleep, you know, we're a nation of people who are sleep deprived, and I could certainly be at fault for that myself. But you need sleep. Your body repairs at night. Your immune system repairs at night when you are asleep and when it is dark. So if you sleep with the TV on or electronic things in your room or, you know, lights on, and you don't repair the same way at night. So, you know, I'm a big believer, rooms should be dark, and don't have your kids leave the lights on. And so get a magic wand. This is what we did. You get a magic wand, which my husband still does with our 16-year-old every night, and says, abracadabra, monsters and snakes be gone. And he goes around the room waving this magic wand, and, you know, then the lights all go off. And, you know, and so she'll come in and say, you know, I need abracadabra. You know, you haven't done that yet. And so, you know, we love that she still wants that. But it was a great comfort to little children. You had this. And we had one of these wands that had water inside, and it had all these little sparkly things that flowed back and forth, and it looked very magical. And
to ask for Christmas.
Yeah. And then the lights went out and it was dark. And but you said, no, you see, you've taken it through the closets and under the bed, and, you know, there's nothing, there's no monsters here. And so dark is important because light comes in to your brain through your eyes. And you have a pineal gland in the middle of your brain, and the pineal gland makes melatonin. Actually, the gut also makes melatonin, but the pineal makes a lot of it. And that is going to deal with our circadian rhythms. But it also is a major regulator of the immune system. So a lot of people don't realize melatonin is a hormone that regulates the immune system. And so if you don't have the proper amount, your immune system isn't going to work. And if you have light on in your bedroom at night, the immune system is not going to be repairing. It has to repair, and it does most of its repair between 10 at night and 2 in the morning. And so if you don't go to bed till 2 in the morning, that's a problem. And so night owls, we know people who are night owls, they have more disease. People who work night shifts, they tend to have more disease. So you have to then have eye shades that are really, really good, or blackout shades, so that you can really get your room dark, because otherwise your body will not function properly.
Interesting. Okay. Well, I've never heard that. So I've been around here for a long time listening to you, and you bring on between the wand and circadian rhythm and all this other good stuff. This is good information.
Yeah. The other thing I like is beta C. I liked it better, I'll be very frank, when it was yellow and smelled like chocolate. You know, I'm not in the business of designing the ingredients, but beta C, when you take vitamin C, just plain ascorbic acid, you can get 200 milligrams in your blood. And after that, the rest you pee out. But if you have bioflavonoids, you can stack it up into tissues more. And beta C has more bioflavonoids than any other vitamin C I've ever found. I look all the time because I'm always want to know, is there something better? Is there something better? And I have not found it. And bioflavonoids are mostly found in the skins of fruits and vegetables. And so if you look at the ingredients of beta C, there's a lot of ingredients. And the more bioflavonoids you have, the more you can stack it up into tissues. Your white blood cells, which fight infection, can take up to 80 times what you can get in the blood. And so when you take beta C, and I tell my patients, if you're starting to get sick, you take 2 every hour while awake. And you will just zoom that level up in your tissues. That increases proliferation of your white blood cells and increases what we call chemotaxis, which is the ability to find their target. And white blood cells actually fight cancer as well. But, I'm mostly telling this for fighting viruses. It doesn't work as well for bacteria, but it works great for viruses. So I never get sick when I fly anymore. I just don't get sick. I always have a bottle of beta C on my desk. I have some in my purse. I carry it with me when I fly. And my whole cancer center lives on this stuff. And they say, I come down and say, I'm starting to get something. Can I borrow some? I'll go get some later and I'll pay you back. I say, yeah, here's 10 and pay me back. I make them pay me back. And they all know it works. And if you just take, plain old ascorbic acid, it's not going to work. And so Linus Pauling was really right about vitamin C, but you have to do it right. And when the government redid his studies, they didn't do it right. They just used plain ascorbic acid. And so it was destined to fail. This is what often happens when the government wants to take over a study that's a nutritional study, and they screw it up because they don't use the right form. They don't, they skimp on the dose. They, do something. There was a big article in New England Journal of Medicine, one of our biggest journals in the world for medicine, a number of years ago on echinacea that showed how it did not help prevent or treat the common cold. And I had people come in saying, see here. And I looked at it and I read it and I said, oh yeah, they use the part of the plant that we throw away. That's not active. That's why they used it, because it was cheap. And they didn't bother to ask anybody, is this going to work? So why they would spend millions of dollars running a study and not get a naturopath or somebody to bless the study is beyond me. I got off on that track, but the kind of things I tell people, if you want to try to stay healthier, you get better sleep, better quality sleep, no light in your bedroom. You're going to take these good supplements. You're going to avoid sugar. The amount of sugar in one can of soda pop, will decrease your white blood cells' ability to fight infection by 50% for over 6 hours. And so you start your kid off with Pop-Tarts for breakfast. And then what do? They go to school and then they have, you put a candy bar in their lunch, and then they come home and they have, they're eating sugar all day long. It's no wonder they're always sick. If I see somebody who these kids are sick all the time, they catch everything, I go, I know they're living on sugar, and get them off that sugar. And that's going to make a huge difference.
Great advice.
Yeah. And the other thing, you need to lower stress. Stress lowers your immune system. It interferes with your immune system because our bodies don't know the difference between the stress that we're under now and the stress of running away from a saber-toothed tiger. It's, we're not that far removed. We haven't changed genetically that much. And so they're thinking about these short-term stresses that you've got to be able to get away. And so what does it do? it says, well, I can take energy away from the immune system and put it in your muscles so you can run. And I can take energy away from the digestive system because you don't have to digest if you're about to be eaten by a saber-toothed tiger. So we'll put that on hold as well. And so when you then have a society with chronic stress, too much noise is a huge stress on the body. And, people live in, big cities. We weren't designed to live with all that noise and honking horns and all those kind of things, and too much traffic and a job you hate and kids. Kids are a huge stress. And I tell people, you have to pick your stresses. What are the ones you can get out of your life? And then how can you change the way you respond to them? And they say, well, I can't change. My kids always make me so mad. I say, no, you choose to let them make you mad. You can choose to look at it differently. And some people seem to thrive on stress. That's because they don't see it as stress. They see it as a challenge. So, if you're really being hit over the head with some huge lifestyle issue, it's amazing how much you can change. I send people for self-hypnosis, emotional freedom technique. Various different techniques to change the way you respond to some kind of stimulus. And it can happen. And you can just let so it doesn't bother you anymore. And that's a very healthy way to live.
It certainly is. And Dr. Browne, something? I've got some more questions, but I'm just fascinated by some of the stuff that you've been talking about. What I think we should do now, John Paul, is open this up for a Q&A if Dr. Browne has a few more minutes that she can spare and have people ask any questions they might have for her.
Absolutely. Everyone is allowed to ask questions or make a comment. You may need to unmute yourself, but other than that, feel free to speak up and go ahead. Does anybody have a question or comment?
Looks like Mackenzie does.
Hi there. Good to see everybody. Dr. Browne, you're a hero. You always have been my hero, and you continue to just enthrall me. I have never taken a flu vaccine in my life. I've had body-wise. And I would wonder what your take is on flu vax.
Well, I am required to get it because as a health professional, I cannot work without getting that. But before that was mandated, I used beta C. And I did knock out the flu with beta C. I remember one time it took me 3 days. I didn't feel great, but I could work. And then I beat it. And I personally do not have a very good immune system. And so I was sick all during my childhood. In fact, I was just talking to my mother about it, and we were talking about, the months I would miss of school, and I just don't have a good immune system. So I'm always looking for things that I can do. And in a way, I am relieved that my work forces me to get a flu vaccine, because otherwise I probably wouldn't be doing it. And this way it takes the decision out of my hands. Do my kids get flu vaccines? No, they do not. Have they ever had the flu? No. They eat right, and they take MMPMs, and they take beta C, and they take HG Immune every day. So, but I think it depends where you start. So, we all have different strengths.
I've never taken so just wanted you to support that. Thank you so much. Mm-hmm. And I'll get a wand very quickly.
Oh, get a wand. They're so fun.
Oh, that's great. Tom raises an interesting question here about how much AG Immune to take, and maybe we could spread that question out a little bit in terms of how much should the average person take, and is there a difference in how much you think one of a patient you might see should take? In other words, somebody who's facing a severe immune challenge.
I don't think we have enough data really to say that. And I think for somebody like my kids take 1 AG Immune a day. They have for years and years and years. And they aren't sick very often because, I can't stay home with them. My husband can't stay home with them. And so, they need to stay healthy. I take 2 AIE10s or 4 AG Immunes, or sometimes it's 2 and what, it varies, whatever I have on my shelf, every day, because I don't have a great immune system, and I'm an asthmatic. And ever since I started AG Immune, I have not had to go on steroids. To me, that is huge. I hate being on steroids. I don't like the way they make me feel. And I don't even think I brought an inhaler on this trip. I sort of forget about it. I haven't used an inhaler in years. It's improved my immune system that much. Now, when I have patients who are recovering from chemotherapy, I don't know the dose during chemotherapy. I tell them, I don't know the dose. It costs money. And so my empiric observation, based on no data except what I'm seeing, is that if you take at least 1 AG Immune a day during your chemotherapy, it seems like your immune system doesn't go down quite so much. And then once you're done, I put them on 4 a day. Now, since you have to take 2 hours between each pill, if you start doing too much more than that, it gets a little bit trickier. And so that's what I choose to do. But and when I had COVID, I took 4 a day, and recovering from COVID both times. So, is that the right thing to do? I don't know. I don't have great studies for that. I would love it if BodyWise would actually do a formal study. That would be nice, so we could get that data.
Right. You have personal experience, and you've witnessed your patients' results taking the product.
Yeah, and I tell them, I say, this is not a clinical trial, but this is my observation. And because I have to be very careful too about what I am recommending, because a lot of my fellow doctors don't really believe in what I'm doing, although they've pretty much come around over the last 30 years. I mean, I used to not be allowed to talk about nutrition with my patients unless they asked me first. So my nurse would go in first and say, Dr. Browne's a holistic doctor. She knows a lot about nutrition. So if you have questions, you should ask her. And then I could say, oh yeah, they asked me. But now they don't do that at all, because in fact, I've got them doing all sorts of different products to decrease some of the side effects of chemotherapy. And it took me a long time to get them to that point, but they've come around. And I teach the fellows. We have a oncology fellowship training program, and they're a lot more open. So I've got them doing all these things that is great. And then they teach the attending doctors. So it works out well.
Fantastic. Any last question for Dr. Browne? No, I think Dr. Browne did an excellent job at answering everybody's questions and concerns, and really new insights into the immune system, even since the last time we spoke with you, which I guess might have been 2 years ago.
It was at the beginning of the pandemic. Yeah, I think it was that spring of 20. And where is this going? Well, the things I said then didn't turn out to be true. I mean, I was speaking for what we knew at that point, but we didn't know. It was something brand new. So we weren't really sure what was going to happen. Now I think we have a far better idea. And if anybody's really interested in world health, we have an advisory board. I'm on the board for my nonprofit, but we have an advisory council, and we have people from all over who are on that council. We meet up by Zoom if people are interested in that. And and it's just kind of telling the story and, helping a little bit if you can think of fundraising techniques, and looks good on your CV.
Great.
And I'm assuming, John Paul, that you're going to be able to put another email out with the and Dr. Browne, say that again as far as with Amazon. Is it what is the
if you go on Amazon Smile, it will do it. It's smile.amazon. And if you've got an Amazon account, you could just put it in. And so every time you buy on Amazon, you can go through Amazon Smile, and you'll automatically get that money. And so when you do it, they say, do you want to pick a charity? They have thousands of charities listed, and you have to be an IRS registered authentic charity, nonprofit. So we are, and it's there's no punctuation in this, and building up, partnering in health and wholeness. And so then that will come up. If you just put building up, which I did the first time I was trying to register, you get like 1,000 things that have to do with construction and all sorts of things. And so you have to put the whole thing, building up, partnering, not partners, but partnering in health and wholeness. And wholeness is with a W.
And
And-
hopefully John Paul can send that out to everybody.
Send that out. That would,
And
you
so
know,
we
that would
have
be
it, and we can, because
that would
I
be
purchase
great.
things on Amazon all the time, and I would love it if part of
Yeah,
that would go
I
right
would,
there.
I would love that. And, yeah, and, you know, even, you know, small donations, $20, I mean, anything will help. Because, money goes pretty far in Uganda. And you get enough people helping, and it adds up to real money after a while.
And if all goes well, when do we expect the hospital to be in condition to be open?
March 1st. I'm heading over there on the 24th of February. The president of Uganda is coming on March 1st. We're doing the ribbon cutting. We may not have enough. We won't have the whole hospital open. It's supposed to be 48 beds. We won't have that many. We won't have it all open. The OR might not be open because we won't have things, but we'll be open in some kind of ability at that point, because that's what we've promised. And the people are so excited. They are so excited. And I'm trying to find vaccines now. I've been contacting UNICEF. You'd think that would be a perfect thing. They do vaccines. So you go online and say, okay, UNICEF, I'm looking for a phone number to say, we've got this facility, and, you know, we'd like to have you come and help us with the vaccines. The only phone numbers are for donations. So I finally got hold of somebody who was very nice, and he says, yeah, you know, for such a big organization, we sure make it hard to get hold of us. And he gave me a phone number in New York, which I've called, but nobody ever answers that phone number. And you leave a message and nobody ever calls you back. And so, you know, I'm getting kind of frustrated. And I think of all those years as a kid when I went trick-or-treating and I carried my little UNICEF box, and, you know, you had people, I mean, a lot of people out there, you did the same thing. They don't do that anymore. And that was just a natural part of trick-or-treating. Of course you did that. And they give you a penny or a nickel, and, you know, and then you go home and say, which kid got the most money? And then I guess I don't know even where we took them to school, maybe, or I don't even know. But, you know, they collected a lot of money that way back then. And, but anyway, so we're looking for partners with anybody.
But you make sure and take a lot of beta C and super AI-10 with you on that trip, young lady.
Well, yeah, there's Ebola there now, so I'm going to take a lot with me.
Yeah.
Yep.
Well, fantastic. And we'll certainly follow the progress, and we'll join in and contribute to it for a successful opening of the hospital.
I appreciate it, but it's amazing what we've done, considering this has been, the first idea was about 4 years ago. And our
Wow.
first fundraising event was the day before the country shut down for COVID. And so, and we continued, we just said, okay, we just plowed through and just kept doing things. And so didn't let it slow us down.
Of course, nothing slows you down.
Nothing really does slow me down. I'm pretty determined.
Yes, you
But you know,
are.
it just shows what you can do, though. You get, you know, you look at who has changed the world. And has it been big committees and stuff? No, it's been mostly individuals. And people would say, well, what can I do? You can do a lot. You know, and people say, well, I don't know anything about fundraising. I said, do you know any people? Can you tell the story? People love to hear this story. And I hear it all the time. I tell my patients, and they go, oh, I'm gonna come back and bring you a check. And I said, thank you. I love a check, because when you put it on our donation button on the website, then we have to pay PayPal for part of that. So I love it when it's actually a check that we get the whole amount. And they do. I mean, it's often not very much, but you know, and that makes them feel good too. You know, it does make you feel good to be helping to be giving back and helping with a project like this. And a lot of people think, well, I would like to help somehow, but I don't know what I could do. Well, here's something you can do.
Got it.
Okay.
Thank you so much, Dr. Browne, for joining us tonight. And we appreciate giving us the opportunity to help in this hospital project,
Thank
as well
you.
as your insights on immune health that
Yep.
will really help us with quality of life going forward.
Good. Okay. And I hope everybody stays healthy this winter season.
Thank you.
Absolutely. We're working on it, young lady.
Okay.
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 Have a good night, everybody.
All
Night,
right.